Good morning. It's a chilly morning by Mumbai standards. I'm sure everybody's enjoying the Mumbai winters. I think Sarita rightly mentioned we are talking of uh, diabetes and how they affect our feet, and I'm going to talk to you a little bit on that and probably give you some guide on how to make sure that these don't affect any of our loved ones and the dear ones. So, without much ado, we have to all understand that India is the epicenter of diabetes quake. We are the world capital of diabetes, and I think there is no mincing words in that. That our diet, our exercise habits play a huge role in that, and unfortunately, because of that, we are one of the epicenters of diabetes, and um, I'm sure you guys are aware of it, and you're oriented towards that as well, and you've seen a lot of talks, you've heard a lot of talks, you've seen a lot of videos on how to take care of diabetes, how do you deal with patients with diabetes, the sugars and everything. But I think today I'm going to focus more on the diabetic foot part of it, the legs part of it. And if you see such beautiful legs with diabetes, unfortunately, when it's uncontrolled and it hits the limbs, it blocks the blood flow to the legs like rest of the parts of the body. These beautiful legs can convert into like these gory images. And I'm not going to dwell on these images for a long time, but you have to understand that this is where the reality lies, and that's how beautiful images get converted into dirty looking feet. So we have to understand that 100 million diabetes patients exist. We need to look after actually 200 million feet throughout their lifetime. Most important is to understand that we have good 200,000 leg amputations done every year due to diabetes, and which is unfortunate. And as a community, as Hinduja Hospital, we're striving to make sure that these numbers dramatically come down as a unit. Most important thing is to understand that 85% of these higher level amputations are infected neuropathic wounds. These are totally preventable. So I think we need to understand how do we work towards making sure that some of these initial issues which crop up during our lifetime are evaluated well, worked up well, and then treated well as well. This is one beautiful study which is done in 2007, which was done by American Cancer Society as well as National Cancer Institute. It was published with a diabetes care group as well. And if you can see here, it is one of the peripheral arterial disease, which is in diabetes. You get heart attacks. When you hear heart attacks, what happens basically in that is that the blood flow to the heart vessels get blocked, either because of diabetes or because of high cholesterol. Unfortunately, the diabetes or the high cholesterol is a systemic effect. It affects across the body in all the blood vessels. And when it affects the leg arteries, it is called as peripheral arterial disease, wherein it causes blockages in the leg arteries, and because of which, unfortunately, less blood flow goes to the leg arteries. And then, if you get some injury, the injury gets exaggerated, and then the wound gets converted into a gangrene, and then eventually you tend to lose the limbs. And if you see the 5-year mortality rates with pancreatic cancer, lung cancer, it is peripheral arterial disease. If you can note in the study, the causes of mortality is even higher than breast and prostate cancers. So it is something which is not seen regularly and not followed regularly. And these are various teams across the globes who've been working for years together on making sure these limbs don't get amputated. Just to give you an overview on that, if you look at the American data, and this is published in 2017, I think I'm not going to dwell on every aspect of it, but you have to understand that every 4 minutes in US, a limb is amputated because of diabetes. Imagine in an Indian scenario, in our rural population, even in urban situations where cost sometimes hampers the growth of the patient's medical care, where our numbers may be even more dramatically bad. Uh, it's important to understand that those who undergo these kind of higher level amputations, the 5-year mortality rate is very, very high. Um, the critical point here, and that's what I'm going to discuss with you guys, is how do you prevent and how do you treat these diabetic feet? That's the critical part of it. I'm not going to dwell too much on the treatment part of it. I think that's the medical side of it. That's our responsibility as and when it comes. I think the biggest focus would be to raise upon you the importance of understanding the disease and how do you prevent at your level. Mind you, the road is winding, replete, and it has a lot of potholes and roadblocks. We have to learn and then pass on the information to the needy ones as well. It's important to understand that the foot ulcer that develops or the gangrene that develops in diabetes is not a surgical problem. It's a complication of a medical problem, which is an uncontrolled diabetes. So it's important to understand that throughout the lifetime, when you keep on seeing, I very often see patients who come with a bad wound or a gangrene, and they typically tell me, Doctor, I've been following the diabetes treatment very well regularly. My doctor had started this medicine and I'm taking regularly. Unfortunately, what they fail to understand is that they last visited their doctor 2 years back. They had started diabetes medicine, but in diabetes, the sugar levels keep on modifying and you need to keep on titrating your medication dose. So what was making sure that your diabetes was under control with these medicines may not hold true 6 months down the lane. And that's one of the reasons why you need regular checks, regular HbA1c report checkings, and regular sugar levels to be checked, and regular doctor visits as well to make sure that the diabetes is controlled well. I think this is more of a medical jargon. I think I'm not going to bother you too much with it. But what you have to understand is that with diabetes, you get a lot of neuropathy. Neuropathy means you lose sensation. You have reduced pain and proprioception, reduced joint mobility as well. And it also causes peripheral vascular disease, where basically patients basically have less sweating, impaired blood flow regulation, as well as they have reduced blood flow going all the way down to the feet, and this in general causes ischemia, the way you get ischemia in the heart because of blockages. Unfortunately, all of these combined together leads to foot ulceration, infection, and then eventually amputation. The critical factor to understand in diabetes is to make sure that the skin coverage, the skin is the biggest barrier and the most important barrier given by nature, and we need to make sure that there is no break in the skin, so there is no ulcer formation, there is no wound formation. Okay. Again, to give you and stress upon the point is that a single visit by a diabetes patient to a podiatrist, in our case a diabetic foot surgeon or a interventional radiologist, before complications occur, can save good 3.5 billion US dollars per year. And this is an Indian study. You can imagine the impact of diabetic foot on patients' lives. I mean, it's so devastating that a diabetic patient would end up spending 10% of their overall annual income in medications related to diabetes. But the moment they get diabetic foot ulcers, this significantly jumps to good 30%. This is for an average Indian income. 30% of their income gets depleted managing the diabetic foot ulcers. And if they get infected, that dramatically jumps to 50%. So it is very cost intensive if not taken care of early. And I think these are the various issues. I think, unfortunately, in our scenario, when you have no complaints related to feet, we never examine them. And I think that's where we go wrong. We never realize the value of regular checks. The way you typically keep on having regular breast examinations, self examinations to make sure that the cancer is not missed. Likewise, feet examination is essential to know that. Now, regular periodical physical examination of lower limb extremities is very, very important in preventing a diabetic foot ulcer formation. And when you do that, obviously what's also important is to sometimes as doctors to know whether the patient has neurological deficit in the foot or a biomechanical defects in the foot. So how do you measure that? And so unless you measure it, you cannot manage that. So in terms of typically as community, when you are seeing people around you, what you can also watch is that patients who tend to have neuropathy may have high stamping gait. They tend to walk with high stamping gait. Sometimes slippers, those who wear slippers without the buckle straps behind, they may come out, or slides may come out while walking. In these typically is a reflective of sensory neuropathy, where the feet cannot recognize that the foot has the slippers have come out. Sometimes they can present with foot drops. you can see a wound or a blackish discoloration or a severe pain on walking. I think these are the things that you have to watch for when you're talking of that. Now, typically, you have to understand that whenever somebody is walking, a comfortable walking speed average is 1.4 meters per second, and that's how the feet strides look like when you walk, left, right, like that. So it's important to understand that whenever you watch somebody, make sure that it's more or less on the similar lines. There is You look for the posture, you look for the speed, if it's somebody is walking faster, slower. These are the factors that tend to uh, affect the limbs more in diabetes patients. In terms of basic test at home, and those are medical tests that can be performed in an institute or a centers, hospitals. But for you to have a check on whether the person's gait, balance, and performance in a diabetic patient is good or not is a simple test called as timed up and go test, where it's a reliable tool. It can diagnose up to 80% of the times. What you basically ask is ask for a routine chair, a dining chair or whatever at home. Ask the patient to sit on that, or a person to sit on that, and get up from the chair without taking any rest, and walk for 3 meters, turn back and return and sit on the chair. And I think these, if they can do within less than 10 seconds, generally it's considered normal. The moment it takes more than 20 seconds, there is a severe gait impairment and they have difficulty walking and coming back. I think this is proven model, wherein if at all you have somebody like that, then at least it's better to go and get them tested in a more scientific way as well. So important thing is, how do you do tests yourself? Now these are various tests which can make out whether the toes or the feet have proper sensations or reduced sensations because of diabetes. And these are various mechanical tools, filaments, tuning forks available, vibra tips available. But at home, probably a simple touch test. You can ask the patient to close, or a person to close their eyes, and just touch the various fingers and ask which finger I am touching. And this may sound very silly, but most patients who have no problem would be able to easily tell you. But diabetic patients with severe neuropathy who have lack of sensation may not be able to tell you, and that's where you start getting them evaluated. Uh, it's important to understand that whenever you walk, and I think this is a simple mechanism of walking, that whenever you walk, the first initial contact is at the heel level, then the fourth contact, and then the heel lifts, and then finally the toes take off. And I think it's important to understand that this is a heel strike, the way it moves down, and if you see here at mid stance, and then it lifts off. Now with good medical Harris mats and various equipments available in hospitals, what we basically do is we make the heat map like this whenever somebody is walking, and we do the tests like that to make sure that whichever the area which are yellow, blue, green seem to be in good condition. But the moment they start turning brown or orange or red, that the pressure points are much higher in these areas, and that's where likelihood of a wound development may happen in future, and you start giving preventive steps beforehand only. So like in this patient, if you see here, probably the video is not working, but if you see here, the heel, there's a red patch which is started developing here on the biomechanics testing. And the moment that happens, this heel is because of the altered mechanics, this heel is likely to have wound. So you can give extra padding to make sure that the wound does not develop in ever future. So typically when you look at the foot from behind, and that's how the axis of leg movement is whenever somebody is walking. In diabetic patients, because of various enzymatic glycations, you tend to get hyperpronate axis changes, and because of which the pressure on the heel, the way I mentioned, starts appearing, and then these patients tend to have risk of developing wounds in this area. So the moment that, you can take corrective steps. You can give them you can give them footwear accordingly, and making sure that that's the kind of preventive steps that are taken. Now, typically, whenever these injuries happen, they cause sometimes blisters, and eventually they end up leading to ulcers. So sometimes it's important to know that when I mention it, whether the temperature is getting low in that area, because if it's a cold area, that the blood flow is reduced in that area. And if you remember from our COVID days, we had these easy thermometers available. We could check the temperatures in various areas, and that's how you can basically check temperatures at home. Very easy to do. In fact, in some of these European and American countries, they have even heat sensitive wireless sensor insoles and bathroom mats. So somebody stands every morning while brushing their teeth and they can get the entire data on the app, so that they know that the temperature anywhere is reducing or not. And obviously people have started there's a society for medical jacking. People start selling the data to the various industry people based on that as well. So that's the unfortunate part of anything that's happening. But important thing is to know that whenever there is a sensory neuropathy and there is a loss of sensation, the feet does not realize what's the level where the hard floor has reached, and it tends to keep on giving more pressure. You lose the sense of position, and then eventually this leads to changing walking pattern, and then hyperpronation, and then the wound that I explained. Same way, muscle weakness can develop in diabetes and cause deformities, eventually again all leading to hyperpronation and causing development. I think for the want of time, I think these are the similar points I'm trying to make. The most important point of importance here is that so repetitive moderate force of unprotected walking all the while can cause the damage in this patient. So it's important in patients with diabetes, with peripheral neuropathy as well as vascular disease, when you ask them to walk, because I think there's a very common tendency for us to tell diabetic patients to take walks regularly, so as to reduce to cause sugar consumption and reduce the sugar levels to peak up. But remember, in patients who've already started developing these leg changes, hyperpronation, and developing these pressure points happening, it's important to understand that their walking needs to be slightly restricted as opposed to others, and you need to start measuring the walking distance in terms of minutes versus kilometers in these patients. So how do you prevent these skin changes that are developing? It's important to understand that you need to critical thing about moisturizing is that you need to moisturize your limb, and they are important is mainly to retain the existing moisture. Soaking of feet, a lot of times people do with warm and salt water. I think these are not good in diabetes patients. The moment sensations are lost, very hot water or very cold water itself can cause maceration of the skin, and it can cause wound development or gangrene to start. So remember, no excessive heat, no excessive cold temperatures are advisable. And then obviously it's important to understand how do you trim your nails, and there are various ways to do that. I mean, you'll put it on Google and you'll get all the details how to trim them to make sure that they are not causing any local injury, because the moment you have some injury, the body's blood flow demand to heal that injury would increase. And unfortunately with diabetes, when you have artery occlusions and blockages in the leg, the demand is not met, and that leads to worsening of all the things. And there are various types of nails. If you have really bad ones, it's better sometimes to go to a diabetic spa sometimes to get things sorted, rather than trying to do everything at home. Important thing to understand is that in diabetes, the footwear is the cornerstone of primary and secondary prevention. It's important to understand that the footwear should do what your feet cannot do. So you need to make sure that various types of footwears are available, right from your simple sport shoes to shoes with extra depth, custom molded shoes, rigid depths, basically various. Whenever you find that you have on examination, you have a red point, the way I showed you the pressure point, what you do is various simple measures like these kind of insoles, and this is the pressure area on the toe. You make a cutout and then put the sole on that so that the pressure in this area further reduces. In fact, you get various footwears where the pressure on the forefoot is reduced if you have a wedge pressure footwear like that. I think in India, a lot of patients tend to use these Hawaii slippers or slippers with these with a ring like that. These, unfortunately, to keep a grip, people tend to have a very high pressure on the toes, and this tends to give pressure on the toes and eventually gives rise to wound care. So I think it's important to understand that how you have dedicated coronary units or heart care units when you have patients with heart attacks, you have stroke units. I think it's important to understand that diabetic foot is an important aspect. You need a proper comprehensive team to make sure that the wounds don't worsen, patients don't develop wounds, and eventually amputations don't develop in these patients. So time is tissue. It's important to understand here, and you have to understand that there's a concept of toe and flow. The flow reduces, the toe can go. So it's important to understand that the flow is essential for the feet as well. Early detection and protection of high pressure areas in the foot and corrective footwear or orthotics is the only strategy to prevent loss of limb in diabetes. And I think these are some of the important preventive steps that can be taken. And if you go on Google, you'll find these 3-minute diabetic foot examination. These are simple steps that can be done at home so that you can evaluate or broadly screen. And the moment you find something abnormal, obviously you can visit the doctor and the team, and they can evaluate and do it better. Diabetic foot. Is this a successful treatment of diabetic foot care where the patient has lost half the limb? No, it is not. And the only way to prevent all that is regular diabetic foot, regular foot evaluation, and to make sure that the feet are taken care of. These are simple commandments given by Diabetic Foot Society. In 10 commandments, you basically do not walk barefoot. Inspect the feet daily for wounds, blisters. You do not apply hot fomentation or cold packs. Use corrective footwears. Do not walk bearing weight on the affected foot. Do not sit crossed legs for a long time. You do not remove footwear during travel. Unfortunately, you can get hurt with some foreign body there. You do not cut the nails. I mean, you need to cut the nails regularly. Trim them in a square way rather than in the round. Do not cut corns, calluses with blades, knives. I think some people have this habit. Clean the feet twice a day with soap and water. Wipe wet spaces. Important final message would be that you need to take care of the feet. Happy feet is what we all want and we all deserve. Thank you so much.